This video focuses on the entrustment scale we'll be using in the workplace-based assessment in Clerkship. The first segment describes what an entrustment scale is. The second segment provides a few examples of how we can apply the entrustment scale to student performance in Clerkship. Entrustment has to do with the ability to become residency ready. The level of assistance a student needs determines the level of entrustment. You already may be familiar with the entrustment scale known as the Chen scale or the Ottawa scale. College of Medicine Tucson will be using a modified Ottawa scale for the WBA process. The top of the scale represents a level of entrustment afforded to an intern, someone you could entrust to engage in a particular task with little to no direct supervision. For example, you can ask a resident to prepare for and conduct a patient interview or physical exam regarding a broad range of conditions, or identify various diagnostic or treatment approaches and engage in patient planning. The range of entrustment level for clerkship students on our scale really focuses on either you having to step in and do it, you talking them through it as they do it and providing help, or you directing them from time to time and providing help as needed. In the new WBA process, students should feel ready to be assessed. They will decide when they will be assessed, which EPA upon which they'll be assessed, and who will do the assessment. Most medical students are new to clinical practice and will need some assistance or guidance in preparing for, engaging in, and debriefing medical encounters. The bottom line is the level of entrustment is determined by the need for your involvement. So if the student asks you to assess them on EPA 1 as they interview a patient and do a physical exam, and it's necessary for you to step in and do the exam, then your student is at the I did it level. To assess the student at a higher level of entrustment, you need to have a lower level of engagement. That means if, for example, a student is doing an ultrasound and you provide some guidance in how to hold the Doppler or guide them in getting a better picture, that would be, I walk them through it. If you need only direct the student from time to time in order to perform the task, then that student is at the third level of entrustment, directed from time to time.